Hello, this is Bryan Rosner with Biomed Publishing Group. And when we talk honestly about Lyme disease treatment, we get down to the point that sometimes Lyme disease treatment itself can be a lot worse than the disease. In fact, some of the side effects of Lyme disease treatments are so bad that they can really prevent people from using those treatments effectively. Now you might ask why. Why are Lyme disease treatments any worse than any other disease treatments? Well, the answer is that in order to successfully eradicate Lyme disease, one has to use a given treatment for a much longer period of time. And with Lyme disease, people often use antibiotics, for example, for 6 months or a year or even longer. Now, personally, I don't use antibiotics to treat my Lyme disease. I use an alternative treatment called a Rife machine. And I wrote a lot about this Rife machine treatment in a book that I wrote called Lyme Disease and Rife Machines that you can get from limebook.com. But recently, I did have to take a 7-day course of antibiotics, doxycycline specifically, to treat a different unrelated health problem. And even just 7 days of antibiotics got my stomach upset. I had diarrhea. I experienced some pretty unpleasant side effects. This got me thinking about basically just remembering the perils of long-term antibiotic therapy. If I experienced those side effects from just a few days of doxycycline, imagine what chronic Lyme disease sufferers experience from a year and a half, 2 years of antibiotics. Antibiotics used for that long can have all kinds of very bad side effects. The IV antibiotic Rocephin can cause gallbladder problems and gallbladder sludge, which can necessitate having your gallbladder removed, which introduces all of the perils of surgery and complications of surgery. Antibiotics can cause white blood cell and immune system suppression that can make it much more difficult to fight off other illnesses. They can cause raging, out-of-control Candida infections that can cause food allergies and inability to digest food. Candida itself can become systemic and actually penetrate through the walls of the intestines and create all kinds of problems, and Candida can become even more difficult to eliminate than Lyme disease itself. So basically the point of this video today is just to remind you how important it is to consider alternative Lyme disease treatments for the purpose of basically avoiding all of those very dreaded and nasty side effects of long-term antibiotic therapy. Now, of course there are some people that do get better with long-term antibiotic therapy, and I have no argument with those people. If you're one of those people and long-term antibiotics have given you more benefit in comparison with the side effects that they've also caused, then more power to you. However, if you're one of those people that are hesitant to use long-term antibiotics, or if you have used long-term antibiotics and experienced a relapse or not experienced the type of results that you expect, or also experienced side effects like Candida or gallbladder problems, you have nothing to lose and everything to gain by looking into different alternative Lyme disease treatments. Now, the treatment that I found most helpful, like I said, was the Rife machine, which is described in my book Lyme Disease and Rife Machines, but there are a number of other alternative Lyme disease treatments that you might want to try to avoid those long-term antibiotics. For example, in my other recent book called The Top 10 Lyme Disease Treatments, I discuss a treatment called the Salt and Vitamin C Protocol, which also doesn't have as many known side effects as conventional antibiotics. Now keep in mind, some of the treatments that I discuss in my books are experimental, so they should be used only under the supervision of a physician, and all of their side effects aren't necessarily known. A couple of other treatments I discuss in this book are the use of herbal antibiotics, and also ways to use pharmaceutical antibiotics, but not in a long-term continuous sense, but instead using a methodology that allows the body to recover between doses of antibiotics. And again, then there's the Rife machine, which I personally found to be most helpful. So this is Bryan Rosner with Biomed Publishing Group, and my hope is that you really do consider the risks and rewards of long-term antibiotics for Lyme disease. It's a personal decision that only you can make with your doctor. And just a little disclaimer, I am a journalist in the healthcare industry. I am not a medical practitioner or doctor, so this video is for informational and educational purposes only. Okay, good luck with your difficult treatment decisions.